Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hi, everyone, and welcome to a fresh episode of ATP Hour. I am Gbemisola Boyede. I'm a pediatrician, and it is my pleasure to be with you again on today's broadcast. And so I want to warmly welcome you. And if you're watching us for the very first time, thank you so much for joining us today. And usually every week we have a teaching section on Ask the Pediatrician that we call ATP Hour, where we talk about important issues that have to do with the health of our children. And so today we're going to be talking about something very important. And for those of you who are seeing me, you can see the title already. We're going to be talking about Down syndrome. So on the 21st of March this year, or every year, we celebrate what we call the World Down Syndrome Day. It's a day for creating awareness about Down syndrome. So we're going to talk about it today. I think of all the special needs condition that children may have, I think Down syndrome is one of the most common ones to almost everybody. And it's so common that sometimes people just say all children who have special needs or additional learning needs have Down syndrome. I've seen that quite a lot of time. However, it is not all children who have special needs that the cause of it is Down syndrome. And so today we're going to talk more about Down syndrome for you to really understand what Down syndrome is and how to support a child or people who have Down syndrome. So thank you so much for joining us. So whether you're watching me on our Facebook page or group, or you're watching on the YouTube or Instagram live, I want to say thank you so much for joining us today. Or you're watching on the podcast as well, Ask Dr. Mini ATP podcast. You are warmly welcome. And for those of you who are listening to me on Fresh Waves Radio or the podcast as well, audio edition, you are also welcome. And just to remind us that after this session, if you have any question about this topic or any topic whatsoever that has to do with the health of your children, you are welcome to head over to Ask the Pediatrician Facebook group. That is our group where you can ask any questions about the health of your children, and our professionals and moderators will be there to provide evidence-based answers to your questions. And if you are the type that like live question and answer, you want to ask a question straight away and get the answers from the pediatrician, you can always join me on Mondays, 6 p.m. GMT plus one. That is West African time. You can always join us on Monday between 6 and 7 p.m. And in that 60 minutes, you can ask any question that you have about the health of your children, and you get your answers live and direct. But for any other time you have questions, go to our Facebook group. It is open Mondays to Saturdays, 24 hours daily. Post your questions there, and we hope to answer your question within 24 to 48 hours. So thank you so much. And so if you also want to watch all the past episodes, last week, Dr. Buki Olatusi was talking about the World Oral Health Day. Healthy mouth is a healthy body. If you want to listen to that, you can listen. And all the other topics whatsoever that you want to learn about, we've practically cover most of the important topics that has to do with the health of children, immunization, breastfeeding, all the various disease conditions. Feel free to go over to our YouTube channel or this same Facebook group or page, and you just search for those topics, and you will see past recordings, and I'm sure you will learn. They're also available on the podcast as well. So thank you so much for joining me today. And so I'm just going to go straight onto the topic of the day. So we're going to be talking about Down syndrome. I'm sure almost everybody listening to me have heard the word Down syndrome before. What you may not have heard is another word called trisomy 21. Some of you may have heard of trisomy 21. Actually, trisomy 21 and Down syndrome, they are these different names for the same condition. So we're talking about the same thing. Medical people tend to use the word trisomy 21. It's a medical jargon, but majority of us tend to call it Down syndrome. And so what is Down syndrome? So we have conditions when it comes to medical conditions or issues that people may have. We have things that people are born with. We call it congenital genetic conditions, and we have conditions that people can have maybe as they grow older, or maybe they are exposed to certain things like infections and all that. So when we are talking about things that people are born with, that is how they are born right from the womb, or things that has to do with the genetic makeup. Down syndrome is one of the most common genetic condition, if not the most common. It has to do with the chromosomes. So when we talk about genetics, we have the chromosomes, we have the genes. I'm not going to give you all those jargons. I'm sure you can remember your biology. So what determines how we develop, how we grow, and everything. They're all packaged in genes. The color of our eyes, the height, the color of our skin, everything about us, they are packaged in these genes. And these genes are packaged with some what we call protein to form what we call chromosomes. Okay, and this chromosome consists of what we call the genetic makeup of the human body. And we have each person has what we call 23 pairs of chromosomes. Okay, so we have 23 pairs of chromosomes. We have what we call 22 uh, autosomes, like body chromosomes, and we have two sex chromosomes. So everybody, that is all that we have. And why am I talking about this? You will soon get to know why it's important to give you this background before I start talking about Down syndrome. So each of those chromosomes are numbered, if you remember. So we have chromosome 1, chromosome 2, chromosome 3, and they are numbered up to chromosome 22. And then we have, for the girls, we have two XX chromosomes. And then for the boys or the men, they have an X and a Y chromosomes. So those are the 23 chromosomes that make up the human body. Um, and what happened is that the chromosome 21 is where we are going today. When it comes to Down syndrome, we're talking about chromosome 21. And so that chromosome 21, like just like everybody, we should have two of them, okay? Just like you have two of chromosome 1, two of chromosome 2, and so on. Because the way we inherit those chromosomes, we get half of it from our dad and half of it from our mom. So the what we call uh the cells that will form a new human being, usually the egg for the woman and the sperm for the men, they have half of those chromosomes. So they will have just 23 instead of 23 pairs. They will just have 23. Whereas the rest of the cell of the body have 23 pairs. So that when half of it from your father and half of it from the mother, they join together to form what we call the new zygotes, or that will develop and become a whole new a new human being. It will have 23 pairs. Half of the pairs is from the father, half from the mother, and then you have a complete 23 pairs, which will now continue to divide and divide and divide until the human being is formed and born as the baby. So what happens is that in people with Down syndrome, that chromosome 21, instead of them to have two of it, they have three. Okay, they have three, either a complete three or part of it, So I just want to make it as simple as possible, and that is why we call it trisomy 21. So 21 referring to the chromosome involved, and the fact that instead of having just two pairs, they have three of them, and that is why it's called trisomy 21. All right, so Down syndrome is a common what we call chromosome abnormality that occurs when a person has a part or full extra copy of the chromosome 21. So normally everybody should have two chromosome 21, but people with Down syndrome have an extra 21, and that is what leads to but that is what is called Down syndrome, and that is why we sometimes call it trisomy 21. So if you want to be technical, you can just use the word trisomy 21, but everybody else can use trisomy, can call it Down syndrome. And so it's one of the most common chromosomal abnormalities or congenital abnormalities, things that a child is born with, or genetic condition, if you like. Now, why is it important for us to talk about Down syndrome? Why do we have to have a day set apart for Down syndrome? Now, Down syndrome is also one of those conditions that is so easy for us to diagnose. When it comes to genetic conditions, sometimes it's very difficult for us to make a diagnosis without doing a lot of genetic tests. But there are some conditions that when we see them, people who have those conditions, we can see some clear distinct features in them. And once we see those features, then we can begin to suspect that this is his condition. And then we can now eventually, if you like, confirm it by doing tests. So Down syndrome is one of those conditions that have very distinct facial features. And so what we say, we know this is most likely Down syndrome. So this is not to say everybody that you see, you begin to think that they are Down syndrome, but there are certain features that we'll see in people with Down syndrome that help us recognize them. And also people with Down syndrome, because of these extra chromosome present in almost all the cells of the body, they are prone to certain health issues. And so, because of that, they will need a lot of support. And that is why it's important for us to know about Down syndrome. And that's why it's important for people who have Down syndrome to recognize that. And as early as possible, we begin to support them so as to minimize some of the challenges or health issues that they may have. And that is what we're going to be talking about today. So I've already talked about Down syndrome. It's a condition where people have extra of the chromosome 21. It can be the full chromosome 21 or just a little bit of it getting extra in that person's body, and then they will have the features. So what are those features that we see? Once we see, we begin to think of trisomy 21 or Down syndrome. So there are features that are common that we see on the face or the head. There are those we see on the rest of the body. So I'm going to show us a picture of what are those distinctive facial features that we see in children who have Down syndrome. The first thing we tend to see is I'm trying to remove the present 21. So there are features that you see on the uh, face or, the head of children with Down syndrome. They tend to have smaller head, which has to have like a flattened kind of the back of the head. So that is we tend to say that. Then there's a way their eyes will look. So the space between our eyes, we call it palpebral features. And so that space in children with Down syndrome tends to be shorter than normal. So we tend to call it short palpebral feature. And then they tend to have what we call epicanthal folds. So don't worry about all those medical jargons, but there are things that we tend to see in children with Down syndrome, and we can begin to figure it out. They also tend to have low nasal bridge. The nose is low and it can be flat. The face generally tends to be flat, and they tend to have short nose. Okay, the some of the other features that they may have include, let me remove the picture so I can just talk. So some of them will have protruding tongue. So sometimes you just see that the tongue is out, and then they have tend to have what we call upward slanting of the eyelid. So most of us, our eyelid, if you draw a line outside of your eyelid, from the middle to the front and draw it out, it should go straight down. And if you draw it to your hair, it should go straight down and cut across like one side of your hair. So, but in children with Down syndrome, it tends to go up. Okay, and sometimes their hairs are also low set, so the hair of children with Down syndrome tends to be further lower down than that of most people. So these are a few features that we can see on the face of people with Down syndrome, that immediately we begin to see that, we see the upward slanting and all that, then we begin to think, wow, this child may likely have Down syndrome. Most professionals are very quick to recognize that. Most pediatricians, doctors. So most time we make diagnosis of Down syndrome right from the time baby is born. Right from the time we have the baby in our hands, we can see those features and we're suspecting Down syndrome. And of course, we're going to do a test. But for parents, you may not likely know. You may know that this baby looks different. You may not know the implication of difference, the way the baby look, because there are different look, and different look, like I said, may go with different diagnosis or genetic conditions. But most doctors who are trained, let's say a child with Down syndrome, they can recognize it and they will now want to do the confirmation. But for parents, if you just see the face maybe look different, you're not sure, then you may want to see a pediatrician. We can have a look and we can tell you whether, okay, yes, this is what we think is going on. So that's the first thing we see in people with Down syndrome. But apart from their look, there are also other medical conditions that they can have. And Down syndrome, because you remember that cell, that's extra chromosome 21, is present in all the cells of the body, virtually all the cells. So Down syndrome manifests in virtually all the organs of the body. So each organ of the body may show sign, that's when we sit together, it also make it look, yeah, this is likely Down syndrome, and which is one of the reasons why we need to know about Down syndrome, which is why we need to identify a child who has Down syndrome, and we need to follow them up, and we need to support them. Another problem that people with Down syndrome tend to have is heart problems. People tend to call it holes in the heart, and there are different kind of holes in the heart that they can have. We have what we call VSD, for those of you who have seen Dr. Ventricular septal defect. It can be a hole in virtually any part of the heart. And this is common in children with Down syndrome. In fact, for some children with Down syndrome, what really parents struggle with is these other conditions I'm going to talk about. It's not the facial features, it's not the way the child looks, it is the complications of all the involvement of other organs in the body, especially holes in the heart. For example, if a child has holes in the heart, that child may need an operation. And if we don't quickly get an operation, the child may have heart failure. And some of my patients that die from Down syndrome, some of them is because they have problem with a very severe form of heart problem. Holes in the heart, the holes are so big, and maybe we were not able to get funding on time to do the heart surgery, and so some children will succumb to that. However, in advanced countries, these children get their heart surgery done so quickly, because once the children are born, we're doing what we call echoes, a scan of the heart to see whether there are holes in the heart or not. And if there are holes in the heart, those children will have surgery straight away, and most of them will do well. But in places where there's low income countries, this may be a very limiting factor for the life of children with Down syndrome who have severe uh, problems with their hearts, and we couldn't get surgery quickly. Another challenge that people with Down syndrome may have is problem with the what we call the digestive system, the gastrointestinal tract. There are different kind of stuff that can have with the gastrointestinal tract. They can have what we call H-prong disease. Even when something for those who don't have H-prong disease, they tend to have constipation, because in Down syndrome, the muscles are very what we call floppy. They don't move as fast. Even when you hold them, you see that even the children, they look so soft and very floppy. And the same thing affects all those other the muscles in the ones inside that moves food along. And so because it doesn't move quickly, they can have constipation, but they can also have H-sprung disease. And people with H-sprung disease tend to present with constipation, and some of them will need an operation to correct that as well. They can also have intestinal obstruction, and they can also have what we call duodenal atresia. They can also have the anus may not be open, imperforate anus. They can also have reflux. So there are different kind of conditions they can have that has to do with the digestive tract. Most common is the H-sprung, the duodenal atresia. And from what I've mentioned, you can see that most of these conditions will require operation. But let me quickly backtrack and say it's not every child with Down syndrome that will have all these issues. Most of them will have the facial look, and even that facial look, some children are not so obvious, some children are very obvious, but majority will have some facial look, but not everybody is going to have the heart problem or the problem with the intestinal tract. Some people don't have any of those problems, and most of those children, they tend to be very healthy. But the children that tend to struggle are those who have holes in the heart or have something to do with their intestines that will require an operation as well. Another organ that is commonly affected in people with Down syndrome is the brain, the neurological system, and they can have different kind of neurological disorders. Number one, most of them, one of the most common features in Down syndrome that tends to often give them away is that apart from the look, is that they look so soft. Most parents will always tell me as if there's no bone in the child's body. You just hold them, they just, fall, uh, they just kind of bend over easily. So they have what we call hypotonia. They are very floppy. And apart from that, the half of the most children with Down syndrome have maybe 50%. We have what we call mild to moderate intellectual disability. In other words, the academic performance may be below that expected for people of their own age, or they may be slower in catching up or understanding things. So they have what we call intellectual disability. Some people also have convulsions or seizures. And in people with Down syndrome, as they get older, they are more likely to have what we call dementia compared to the general population. So these are the common problems they can have in terms of neurological disorders. Also, it can also affect the blood. Hematological disorders are also common in people with Down syndrome. So they can have what look like leukemia, but sometimes it is not like the full leukemia, it's just a transient one. So their blood level, their white blood cells will go so high. Somebody was asking us the other day, why are blood levels so high? Sometimes in children with Down syndrome, their blood level, white blood cells can be so high, but they will be fine. And they can also have other abnormalities of it could be the platelets are so many, or the red blood cells are so many. So those are not the major issue, but it's something that can also happen in children with Down syndrome. Another common condition that people with Down syndrome are prone to is problem with the what we call the endocrine system, endocrine disorders. This has to do with those organs in the body that produce hormones, and these hormones are important for regular functioning of the body system generally. And one of the common hormones that people with Down syndrome tend to have issues with is the thyroid hormone. So people with Down syndrome tend to have what we call hypothyroidism. So they tend to have low level of the thyroid hormones. And the good news, however, is that we can actually replace that. So one of the tests we do for children with Down syndrome is what we call thyroid function test. So we test the thyroid function level almost annually every year, and most of them is fine. But if it is low, in which case the child has what we call hypothyroidism, then we can now treat that. We can give them the tyrosine, the hormone that is missing. We can give it as a drug that they can take into their body, and that will correct it. And it's very important because hypothyroidism on its own can also cause intellectual disability. People with hypothyroidism can also be overweight. They can have low level of intelligence, but it's a treatable cause of intellectual disability if we pick it on time. So if we pick that the thyroid hormone is low and we give the thyroid hormone, that will quickly correct the issue. So that's why we need to follow up children with Down syndrome. We need to check all these levels in them, and we need to, treat the ones that we can treat. And luckily, we can actually treat hypothyroidism. There are also other ones. Sometimes they can actually have the hyperthyroidism. In other words, the thyroid hormones can be too many, but that is actually rare. The common one is the hypothyroidism. They can also have other problems for the boys. They can have small penis, micro penis. They can have what we call cryptorchidism. That is undescended testes. They can have other, and generally most people with Down syndrome can have what we call delayed puberty. In other words, it will take them longer to achieve puberty and develop this secondary sexual maturity status. So these are common conditions in people with Down syndrome. Another area where they can, apart from the endocrine disorders, they can also have problem with the muscles and the bones, what we call musculoskeletal issues. They can also have musculoskeletal disorder. I've already talked about the fact that they are very hypotonic, and they can also have reduced bone mass, and this can lead to breaking of the bone. They can have fractures easily. They can have vitamin D deficiency. They can be slow with their growth, so which one of the things we do with Down syndrome follow-ups, we make sure we check their weights, we check their heights, and when we check the weight and the height, we don't plot it in the normal scales for everybody. We actually have the ones for people with Down syndrome, so we have their own growth charts separate from that of the general population, and we actually, because we plot them into the normal growth chart for the children without Down syndrome, it will look like they are always very low and below the normal age, the normal weight and height. So we have to use the Down syndrome charts, and that is how we monitor them. So children with Down syndrome, apart from the fact that they can have growth problem, they can also have problem with their neck. They can have some problem with the spinal cord area, in the neck area, what we call the cervical uh, vertebrae area. They can have issues with that. They tend to be short, and they tend to be short generally. Their hands tend to be short as well and broad, and they can have small fingers and all that. One of the other features we also tend to see in Down syndrome is that when we look at their hands, all of us have what we call palmar creases. If you look at mine, you can see about three of them. But in children with Down syndrome, they tend to have one, and then they tend to have it going from one hand, they will call it transverse. So, most of the creases on our hands, you see they go, up and down like that. But for children with Down syndrome, they just go straight across. It's transverse and may just be single one. It is not in all children, but it's also one of the common features that once we see it, we know that, yeah, this is likely Down syndrome. So, but that doesn't cause any problem. But generally, they can be short and they can have problem with their spine, um, and they can also have easy fractures because of the decreased bone mass. All right, and there are other issues. People with Down syndrome, they can have problem with their eyes. So most of the time, we ask them to check their eyes annually. They may have what we call refractive errors, in which case they need to wear glasses, and they may also have problem with their hearing. So they tend to have what we call conductive hearing loss. So we have to check their hearing every time, and they can also have problem with their throats. They can have problem with what we call obstructive sleep apnea. So sometimes we need to refer them to the ENT doctors for proper evaluation. So we can see that virtually all the organs in the body can be affected in Down syndrome, and that is even more significant than even just the way the children look. I think the major challenge is those complications that they can have with each of these organs in the body. But good news, like I said, is that it is not every child that will have every complication, and some children don't have none of those complications. And so I will still talk about myths and facts about Down syndrome later, but that is just telling us Down syndrome and the features of Down syndrome and the challenges or health issues that it can have in virtually all the organs of the body. Now, how people may want to know, what is the cause of Down syndrome? Why do some children have Down syndrome? All right. So I already have told you that this is the issue that has to do with um, the chromosome 21, and so it is something the baby is born with. And so the issue with Down syndrome tends to occur during the time the mother and the father are about to form the baby. Okay, so like we said, we all get 26, we all have 46 chromosomes. We get 23 from the father and 23 from the mother. So sometimes when the body is going to produce those cells, the sex cells, that is going to form the egg or the sperm, it undergoes a process of what we call division. So a cell that has the number 46 will go into what we call a meiotic division, for those of you who still remember your biology. And so it's going to break it into two so that you can have 23 here and 23 there. But sometimes things do go wrong during that process. For some reason, sometimes instead of the division to leave 23 here and 23 in the other side, it actually take all the 46 to one side and leave 0 on the other side. Or it takes the 23, 23, but maybe instead of the 21 chromosomes to instead of for the chromosome 21, instead of the two of them to break and one goes here, one goes there, the two of them decide to go to one side and leave the other side without any. So this is what tends to happen. And so if let's say that is the egg, if the father now produces his own 23 normal, chromosomes, and it meets with an egg that has two of the chromosome 21, then and it forms into the fetus, the zygote, and become the baby. Then that baby will be having 23 of the 21 chromosome 21, and that baby is likely going to that baby is going to have Down syndrome. So that is how it happens. And we don't know why it happens in some people and doesn't happen in some people, but we have what we call some risk factors. And sometimes it is not the whole chromosome 21 that is moved. Sometimes it could just be a part of it that breaks off and joins to another chromosome. I don't want to make it more complex, but so that but people that are medical professional will understand that. So sometimes a part of that chromosome 22 may have broken and joined to another chromosome that is not 21. But when during the period of break, it will follow that particular chromosome. So at the end of the day, that person will have the normal 21 chromosomes too, and the extra one that break off from somewhere else and join to another chromosome. And so that person will still come across and have what look like Down syndrome, though it may not be as classic like the other one. So this is how Down syndrome happens. It happens during that period when the cells have been broken down to form the sex cells that was going to form the new human body. So we have the three types of Down syndrome. We have what we call the trisomy 21, where it is it is the whole chromosome 21 that is moved. And so you have three of the whole chromosome 21. You also have mosaic Down syndrome. Mosaic Down syndrome, some cells of the body have the trisomy 21, trisomy 3 chromosome 21, whereas there are some cells that have the normal 2. So people like that tend to have a milder picture. And then you also have what we call the translocation Down syndrome. That's the one where a part of the chromosome 21 actually break off and join another chromosome. And sometimes if it is in the same person, that's okay, because even though the chromosome 21 is not where it should be, but it's still in the same person, it is fine. But what happens is that when that person is going to have their own children, and when they're having the breakdown of that single cell that's going to form the sex cells, either the egg or the sperm, that translocation will also go through that place. So at the end of the day, that person may end up giving another person what we call unbalanced translocation, and that person may have trisomy 21. But don't worry about the medical explanation, but just understand that the challenges with what leads to Down syndrome happens during the formation of a new baby, and it has to do with the fact that the division didn't happen quite all right, and part or the whole of the chromosome 21 is in we have two of it where it should not be two instead of one. I think that is the easiest and the easiest way for me to explain what happens in Down syndrome. So, like I said, we really don't know why it happened in some people, but we know there are risk factors. In other words, it tends to happen in certain people more than the others. And so, what are the risk factors? People are more familiar with the fact that advanced maternal age. So, usually women above the age of 35. It doesn't mean that all women above the age of 35 will have children with Down syndrome. So I've seen women who have their children at 40, 43, and they don't have a child with Down syndrome. But the chances that you are going to have a baby with Down syndrome is higher the older you get before you have your baby. So, which is why pediatricians, gynecologists, we tend to recommend for women to have their babies between the age of 18 and 35. That is the ideal age to have babies. But I know these days, technology, women are getting, academics and all that. So sometimes women get married late and they still want to have their babies at 40, 41. No problem with that. But one of the things we always will tell you is that your chances of having a child with Down syndrome is a lot higher than if you've had your baby before you were 35. And sometimes in some places, we actually screen those pregnancies for Down syndrome. So we have some ways for which we can screen. There are some factors which we look and then we say, oh, the risk is high, and then we can do some tests of in the mother's blood and some tests of even in the baby, and then we can confirm whether the baby actually has Down syndrome before the baby is born. And some of them will say, okay, I don't want to have the baby, I want to go for elective termination. Why some will, it's your choice, but doctors can predict whether a mother who is really old is going to have a baby with Down syndrome, and they can advise appropriately. So that is just the issue with that. Also, if somebody, another risk factor is if somebody already has what we call that translocation. So in that person who has what we call a balanced translocation, all your chromosome 21, they are not in the same place. Some are maybe joined to chromosome 2 or joined to chromosome whatever, 14, whatever. So for you, it is not a problem. But when you are going to have a baby, if you break your chromosomes to have a baby, to form your egg or your sperm, you may end up giving the baby an unbalanced translocation, and that child will manifest as Down syndrome. So that is another risk factor. And another risk factor is if you have already had a child with Down syndrome, the chances that you can have another child with Down syndrome is higher, especially for younger mothers, because if you did that, you already have translocation. That's why the baby has Down syndrome, and those who have translocation, it can happen again. So those are the risk factors. But the truth of the matter is that a lot of mothers who have Down syndrome are young mothers who are not old, because obviously it's young mothers that have children generally, and so we don't always have the answers. We don't always know why some people have babies with Down syndrome, but we know that the risks are higher with older mothers, people with balanced translocation, and so on. Now, how do we make a diagnosis of Down syndrome? How do we know when a child has Down syndrome? Like I said, Down syndrome is one of the conditions that is so easy to diagnose, especially for those of us in the third world where we don't have the technology. I think it's only very recently that we started doing some of these genetic testing locally in mid and developing countries, so mid and low income countries. But without even genetic tests, we were diagnosing Down syndrome quite a lot because we can see it. We see it. All the features are there. So we are able to diagnose Down syndrome. This is one of those classic conditions. You see it, you make a diagnosis. And true, but we can confirm it by doing what we call a karyotype, because not all children look very distinctive. Some children don't always have all the look. And so we still need to confirm whether they have the look or not. We can do a genetic test, and it's a very simple genetic test we do. We call it karyotype. So basically, we count the chromosome. We look under the microscope at the chromosomes and we count them, and we can see if there are 3 of the chromosome 21, and then that is it. Confirm Down syndrome. So we often do it for everybody who has Down syndrome. So for those who have Down syndrome, maybe in Africa, your child may not have had karyotype. but it's available and it's not expensive. I think the last time I checked, it was 40,000 naira, and it's available. So it's something that is easily done. It's not that very pretty expensive. Maybe it's more expensive now, though, but it is a condition that we can easily diagnose clinically, and we can also do um, uh, what's it called? We can do a karyotype test to confirm it. And now the question is, after we've made a diagnosis of Down syndrome, how do we manage Down syndrome? How do we treat Down syndrome? Obviously, Down syndrome is not a condition that has a drug or something for it. Okay, before I go into the treatment, let me go back to diagnosis, that we can actually diagnose before the baby is born. So diagnosis is not just only after the for those who have been born with Down syndrome. We can do what we call prenatal diagnosis. We can do screening. Well, there are many tests we can do before the baby is born, and there are some tests, like I said, that they do for mothers when we suspect that you may have Down syndrome. So there are triple tests, and those tests your gynecologist can do. So it's also one condition that we can also diagnose before the baby is born. So we can diagnose it before the baby is even born, and we can also diagnose it after the baby has been born. So that's the good thing about Down syndrome. In terms of treatment, it's not a drug treatment thing. We cannot change anything in the gene. We cannot reverse the trisomy 21. We cannot take the chromosome 21 back. We can't fix that. So somebody who has Down syndrome will always have Down syndrome. So they are born with it, they will live with it all their lives, and they're going to die as having Down syndrome. But what we can do is that each of those challenges that they have, we can manage them. So we treat every case as they come. So we handle the problem with the heart, the problem with the intestine, the problem with the bones. So what we normally do for children with Down syndrome, because we know they are prone to all these health issues, and we have to do what we call a surveillance. So we have to see them all the time. We need to see them. Usually, we see them at least not less than annually. So if your child has Down syndrome, your child should be seeing your pediatrician every year. It's not something that you just leave and say, okay, the child is fine. No, the child has to see the pediatrician every year. In fact, in the first 5 years, we see them every 6 months. We have to do certain tests. So for each of those conditions I've mentioned, we look for them. So when the baby is born, we confirm it. Clinically, we do the karyotype. Then we do head to toe check. We look into the heart. Is there any hole in the heart? And if we scan the heart, if there's a problem in the heart, we have to do surgery. We check the intestine. Is there any problem there? We have to fix it. Is there any problem, with all the organs? We check the eyes, we check the ears, we check everything, all right? And we check the thyroid hormones, we check all these things, so that if we pick up any of those complications, then we refer. So usually a child with Down syndrome, we need many different doctors at different times. So if there's a problem with the heart, we're going to send the pediatric cardiologist. If there's a problem with the intestine, we send to the pediatric surgeons. Problem with the ears, nose and throat, we send to ENT doctors. So there's a pediatrician, usually the developmental pediatrician or the community pediatrician, who is the coordinator, and making sure seeing the child and making sure every other professionals who need to see that child is seeing that child. We send them for the eye test. We check their eyes all the time. We check their hearing all the time. We check everything. And sometimes the children may need, because they tend to have developmental delay, they tend to have intellectual disability, so they will need support if they have speech delay. So we are monitoring their development as well. If they have speech delay, we will send them to speech therapists. If they have slow, walking and all that, we may need physiotherapy at some point. So we tend to send them, everywhere according to their needs. And some of them, even when it comes to education, they may need special school. Some of them will be able to go to mainstream school. And we have people with Down syndrome who have finished university, who have gotten degrees, who are doing so well. But we also have people with Down syndrome who may not be able to go with the regular mainstream education, and we have to refer them to special needs school. Some of them may not be able to do, academic stuff, they can do vocational stuff. So we have to support them. So that is the job of the community pediatrician or the developmental pediatrician. And we do it all the time until they are old enough to be on their own. So we monitor people with Down syndrome all their lives. You must see them at least annually. So please, for mothers, parents who have Down syndrome, listen to me. You are not supposed to just sit and leave the child. If we're able to monitor the child, we don't wait for things to happen. We are actively looking at them. We are checking their thyroid hormone because, like I said, we can treat the thyroid hormone deficiency. We can give them thyroxine. So we're always checking them for everything, and we can treat what we can treat, and we manage what we can manage. And that is what we need to do. So I'm going to round up by looking at a few myths, about 5 or 6 of them that are common when it comes to Down syndrome. Well, number one, Down syndrome is a rare disorder. No, it is not. In fact, Down syndrome is like I said, is one of the most common, what we call chromosomal disorder or genetic condition. It's about, in US, for example, about 1 in 772 babies is having Down syndrome. So it's a very common condition. Number two, people with Down syndrome are only born to older parents because most of us say the risk factor. I think that's what most of us remember for our biology is that children with Down syndrome are born to women above the age of 35. However, like I said, a lot of mothers I know are actually not old. A lot of mothers I know that have Down syndrome babies actually are young mothers. So yes, the risk is higher in older mothers, but how many other mothers are having babies anyway? Not so many of them. So it is usually the young mothers that are still going to have babies with Down syndrome. So there are other risk factors beyond the maternal age. So it can happen in young mothers as well. And some mothers are actually very devastated because, like, I'm young, so why should I have a baby with Down syndrome? Which is one of the things I should have mentioned in the management. We also support parents and we allow parents to support each other. And there are a lot of Down syndrome association. Even in Nigeria, we have Down syndrome association of Nigeria. So it's good for parents to belong to this and support each other or any of those support groups for parents of children with additional learning needs. Very important. All right. Parents will not find communities in bringing up their child with Down syndrome. This is very interesting that this is coming up after I just said that we have support group. We actually have. So this is a myth. Don't think you're alone when you have a child with Down syndrome. There are several people who have children with Down syndrome. So please get support. All people with Down syndrome have severe cognitive disability. This is not true. There are several people who do not have who have only mild intellectual disability. Like I said, I know graduates who have Down syndrome. So, and we've seen some of these videos or films of people with Down syndrome, how they got married, how they live their lives, and they are really impacting people. If you just go online, just search for some of these things, you'll be impressed. So, of course, there are some children that will have severe disability, but not everybody. And some people are able to live normal lives. And another myth is that people with Down syndrome are always sick. No, like I said, all those multiple issues I mentioned, some children don't even have any at all. They are perfectly fine. So it is not everybody that we have it. And there's another popular myth is that people with Down syndrome always are happy. Of course, they are happy, but it is not like they're happy all the time. They also have other emotions as well. All right, so we finished today. But like I said, if you have any question about Down syndrome, don't forget to ask. And I'm sure on our Facebook group, we'll be able to answer it. I just want to encourage you, if you have a child with Down syndrome, please make sure you're seeing your pediatrician and they're able to support your child. Thank you so much for joining me. Until I come your way again next week with another important topic or any of our other doctors, please keep taking good care of your children and have a wonderful Easter. It is bye for me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children.